Hi everyone, my name is Melanie Grant, and this is C&M Glass. Today we're doing Coding with Miss Melanie segment, review of Coding Clinic from January 30th, 2019. We're going to split this into two parts so that we can talk a little bit about everything that pertains to all of the classes, and then we'll go into some coding specifics for 2030 and 2021 that were addressed this week. Okay, so our key points today, we're going to talk a little bit about abstracting, parts of a note, and physician query, as well as a couple tricks with your coding lookup. This should pertain to all of the classes, but if there's a little bit advanced for you from where you're at, go ahead and make notes of it because it will always come in handy. Okay, so the first thing I've noticed a lot of questions about, how do we abstract or how do we know exactly what we're looking for or where to find it? So our abstracting 101, we're looking for two things, your procedures or your service, and the diagnoses or the reason that the patient was seen. So in your procedures, there should be certain questions that you're asking yourself as you read through the note to determine what it is that we're doing, where we're doing it to if it's a procedure specifically, how we performed that procedure, and sometimes even when did we perform that procedure in terms of the patient or in terms of the service. Where would we find those? Well, terms like op note automatically tells you if you have a surgery, you'll find all of your details to the surgery inside the op note. Sometimes you'll find terms that say diagnostic services that were done or therapeutic services. Those indicate the type of procedure, and also you'll find information oftentimes in your plan. So these are some important things, and we have an example we'll look at here in just a moment. And then we always want to determine, why are we doing this? Our diagnoses determine where the problem is, how it occurred, or how it affects the patient, sometimes what kind of manifestations are occurring from an original diagnosis. And this information can be found in the impression, assessment, and sometimes within the note itself, such as your HPI, ROS, and CC, which is your history of present illness, review of symptoms, and chief complaint. So let's talk about that for a minute. We have an example here of a patient that comes in with a cough. Chief complaint is cough. Patient with, a little C with the line above it, is medical shorthand for with. So a patient with a cough for 2 weeks has a headache and sore throat. Review systems say negative for nausea, vomiting, but positive for fever. Upon exam, there was redness in the eyes, TM, tympanic membrane, that's your eardrums, and the throat. Patient appears to be sick. A strep test was negative. Okay, so I did a bunch of shorthand here. So oftentimes you'll see the shorthand, sometimes you'll see it completely written out. Diagnosis for sinusitis, and the plan is for a strep B test with rest and fluids. So a little bit about this example. Number one, this would be an office visit either in the urgent care office, family practice, or internal medicine office if they're the primary care provider, or sometimes an ER room. This would not be located in a hospital setting, most likely. We would be billing a service for seeing the patient, and we would look at all of this information from our CPT manual. Other things that we can find in here, were there any procedures? What that was done? Yes, a strep test was performed. And again, this one's going to fall under professional services. Those of you billing in PCS right now, think about this in terms of what kind of procedures might you see in your office. Was there any other procedures? No. We have a plan for a strep B test. We have a plan for rest and fluids. So none of that is being done to the patient. It's simply planned for later. And so that's something you'll commonly see. Now, let's say that you're looking at this, though, and you come to a determination that something's missing for the note. Perhaps they said a strep test was done, but instead of saying strep test negative, they just said strep test was performed. At that point, you're going to say, okay, I need to determine if this patient is positive for strep according to the documentation, or if it was missing. Or maybe I need to determine what kind of strep test was performed in order to determine the correct procedure for my billing. That's when you're going to query a physician. A query has a couple things that you want to keep in mind. There's missing information. Something that needs to be listed, but it's not there, and you cannot select a code without it. Or perhaps it's inconsistent. The provider said it was strep test negative and then later said the patient had strep instead of sinusitis. In that example, you would want to query the provider and ask them, hey, I noticed that you said this and I noticed you said that. And which one is correct, or is something else correct? The thing to keep in mind is you should never lead a provider with your questions, and you should never give them what you want it to be. So never lead them and never give them closed-ended questions. What are closed-ended questions? Well, questions that don't have an opportunity for anything other than specifics 1 or 2. So if I were to say, is your hair blonde or black, and you had brown hair, you wouldn't be able to answer that question. But that would be a closed-ended question because I didn't say, is your hair blonde, black, or another color? So when you're querying providers, it's important to keep that in mind. That's it for this part of Coding Clinic segment overview. We're going to look at some of the specific coding lookups in our classroom segment part 2 of our Coding Clinic. So go ahead and click on the next video and we'll talk to you soon.